and what dressing products they have on it currently. Okay, into the patient's space. Good afternoon, Mrs. Berry. How are you?
Good, thank you.
That's good. My name is Fleur. I'm a student nurse here at UTAS. Do you mind if I ask you what your name and date of birth is, please?
Sure, it's Helen Berry, 25th of the 5th, 1955.
Lovely, thank you. And could I please have a look at your name band?
Sure.
Thank you. So just checking the details here. Helen Berry, I can see that the date of birth and the URN match what I've got on the chart, and it's a white name band for no allergies. Thank you very much, Mrs. Berry. So I've come in today to have a look at your wound and replace the dressing. So what that would involve is me lifting the old wound to make an assessment of your wound, lifting the dressing, sorry, to make an assessment of your wound and then to apply a new dressing. Would you be comfortable with me doing this today?
Yeah, that's fine, sure.
That's great, thank you. Can I ask, do you have any pain in the wound or on that leg at all?
No.
And if I was to ask you for a pain score out of 10, what number would that be?
Oh, 0.
Fabulous. Okay, so just looking at your position in bed, I can see you're lying down. Are you quite comfortable in that position?
I am, thank you.
That's great, thank you. I'm just going to make sure that the curtains are pulled around the bed space so that you've got privacy. And I'm just going to raise the bed slightly so that it's a good height for this procedure. Okay, Mrs. Berry, is it okay if I just pull the bedclothes down to have a look at that wound?
Sure.
Thank you. So just looking here, I can see that the dressing is in place there. That's good. I'm just going to pop some gloves on. Okay, I'm just going to lift the dressing from the corner just to have a look underneath. And I'm going to apply my assessment called the wound assessment triangle. Just having a look at the, first of all, the bed of the wound bed. I can't assess that because I can see it's actually a closed wound. It's got stitches in place. I can look at the wound edges though, and I can see that they're well approximated and that there's no bleeding and there's no exudate there. They don't look red. They look like they're joined together well. And the surrounding skin is, peri-wound skin looks like it's the right same colour as your skin tone, so I don't see any signs of infection. There's no maceration or bruising or other trauma. So I'm happy with that. Thank you very much. I'm just going to pop that back down. Okay. Mrs. Berry, I'm just going to go and collect my equipment if that's all right with you.
Sure.
Just pop this bit close down here. Lovely. First thing I need to do is to clean my trolley. Just going to take some clean wipes here. And prepare my clean area for my aseptic field, starting at the top. And I'm going to clean around the sides and also clean the bottom part of the trolley. That's where I'll gather my equipment. Okay. Now the equipment that I need. The dressing pack, the dressing products and the solution. Okay, so I'm going to prepare my aseptic field. First of all, the dressing pack. I'm just going to expose that aseptic field. I'm going to use the yellow tongs to set up my aseptic field. Happy with that? Okay. I'm now going to open my dressing products and put them on the field as well. The primary dressing, and this is the secondary dressing. And I need some solution. checking that's in date. Beautiful. And I just have my bin positioned between my procedure trolley and between my patient. Okay, Mrs. Berry, I'm ready to get started with the dressing now. Do you mind if I draw back the bedclothes again?
That's fine.
Thank you very much, Tara. Okay. It's time for me to remove that old dressing, so I'm just going to perform hand hygiene and pop some gloves on again. Okay, just lifting that dressing again, Mrs. Berry. That's lovely. Okay. Into the bin. And you're ready to go. Okay, I'm choosing to wear gloves today. I'm not actually touching any of the key parts or key sites. I'm using a non-touch technique, however. I am choosing to use gloves just because of the risk of body fluid contamination. Okay, Mrs. Berry, I'm now just going to start cleaning your wound, so hopefully this won't be too cold. Let me know if you feel any discomfort at all. Just going to moisten a couple of swabs. All right, Mrs. Berry, I'm just going to start cleaning here. So I'm going to clean from proximal to distal, first down the centre of the wound. And now I'm just going to clean either side. You doing okay there?
Yeah, fine, thank you.
Fabulous. Now I'm just drying the edges of the wound. Okay, Mrs. Berry, I'm now just going to apply that fresh dressing to your wound. I no longer leave my tongs, so I'm going to discard these. I can just apply this secondary dressing. Okay. That's lovely, and now I'm just going to lift off the edges. Under here to write the date on there. All right, how are you feeling, Mrs. Berry? You okay?
Yeah, good, thank you.
Fabulous, thank you very much. I'm just going to write the date on that dressing strip so that we know when to change it again. Okay, thank you very much. I'm going to clean up my area now. I'm going to wipe down the trolley again in preparation for next time. Berry, I'm just going to document in your wound care chart what we did today. Thank you very much for your time.
Thank you.
All right, oral medication administration. So I'm going to enter the medication preparation space here to review my medication chart to confirm a valid order. So the first thing I need to do is look at this chart. First of all, do we have our patient identifiers? So you can see in the identifiers box, I have a full name of a patient, I have a URN number, and I have a date of birth. So I'm happy that I've got 3 points of identification in that field. Over here is the allergies section, and it has been filled out. This patient has an allergy, and I can see that that information has been signed and dated. Now moving on to my order, I can see I have a medication that's been ordered here, paracetamol. That is a generic drug name, so that's good. I have a date of order present as well. I can see that there is a route that is present, PO per oral. I have a dose of 1 gram that has been written, and the frequency has been entered as 6 hourly. The prescriber has also entered the administration times in the corresponding column. There is a section for indication on this particular chart, and that's been filled in with pain. Pharmacy has not yet reviewed this chart, but that's okay. Prescriber signature and a legible prescriber's name is present, and a contact number. So I'm happy that I have a valid medication order. The next thing I need to do is have a look at the medication, do some research, and determine that it's the right medication for my patient. I need to know all about this medication before I go and talk to my patient. So I'm going to use Tiziani's Nursing Guide to Drugs. I'm going to go to the back of the resource into the index, and I'm going to look for paracetamol, which is alphabetical order. And once I have found my paracetamol, I'll go to the corresponding page. 33. Okay, and here I can see I've got paracetamol generic drug name. This resource will tell me the indication for the medication. It'll tell me the actions, the use, dose, adverse effects and side effects and interactions. So first of all, I need to know what it's for. So I can see here that the action is an analgesic, and I'm thinking about my patient, Helen Berry. She has been to surgery yesterday. She's a surgical patient, so it makes sense that she's going to need some analgesia. So I'm happy that I've got an appropriate medication for my patient's condition. I can see here that it's got oral formulations written, and that there's a dose, a recommended dosage for an adult. And I can see here that I've got an oral order, and that the dose corresponds with the recommendations in Tiziani. As I'm looking through this resource, I'm looking for adverse effects and side effects, just so I know what I need to let my patient know about. And I can also see that it's a section for interactions here. And looking through this section, I can see that Mrs. Berry hasn't been charted for any of these medications that interact with Panadol or paracetamol. So now that I've done this, I'm happy that I have a good medication for my patient. I'm going to go and talk to her. Okay. I'm going to take my medication chart with me. All right, so I'm going to enter the patient space here. Good morning, Mrs. Berry. How are you?
Good, thank you.
Fabulous. I'm Fleur. I'm a nursing student here at UTAS. Could I ask you please to tell me your full name and date of birth?
Sure, it's Helen Berry,
Yep.
25th of the 5th, 1955.
Oh, fabulous. And do you have an armband that I can check?
Yeah,
as
I
well?
do.
Thank you. I'm just making sure that I've got the right documentation for you here. Okay, and I can see that the name, date of birth and URN number matches what I've got on your name band. And Mrs. Berry, do you have any allergies?
I do, yes.
Okay, what's your allergy to?
Penicillin.
Okay, that's good, because I can see on your medication chart that we have penicillin listed as an allergy here. Mrs. Berry, I'm here because we have a medication that's due for you to take now. This is called paracetamol. It's an oral medication, which means that you swallow this in tablet form. This medication is for pain relief. So can I ask you, do you have any pain at the moment?
Oh, I do, just a little.
Okay, if I was to ask you for a score out of 10, what would your pain be?
Oh, maybe 3?
Okay, I see. Well, paracetamol has been written up regularly for you to keep your pain under control. So are you able to swallow tablets?
Yes.
You are, fabulous. And I know that you're not fasting anymore, so this would be an appropriate medication to give to you now. I've had a look in the drug resource, and I can see that there's that we do have an oral dose formulation available, and that the order is appropriate for your condition. There are very rare side effects for paracetamol, but they're very unusual. There may be some cases of dizziness and nausea, but other than that, it's actually a very well tolerated medication. Do you give consent to receive this medication today?
Oh, yes, sure.
Okay, fabulous. And what I will do is come back afterwards and just check to see how that paracetamol has worked for you and conduct another pain assessment.
Okay.
Okay. All right, I'll go and prepare that medication now, Mrs. Berry. Do you have your call bell present?
I do, thank you.
Do you need anything at the moment?
No, thank you.
Lovely. Okay. So I'm going to leave the patient space and come back into the medication room. All right. Now at this stage, I'm going to need my preceptor, RN buddy or assessor to check my medications with me. So Lee, would you mind being my double checker?
Sure.
As we conduct the 3 checks and the 6 rights?
Yes, I can do that.
Fabulous. Okay, so the first thing I need to do is select my medication from the stock. So Lee, I can see that I have paracetamol charted here for Helen Berry. And going to my stock, I can see I've got paracetamol in a bottle form here. So looking against the chart, I've got paracetamol, and that's paracetamol. The formulation is 500 milligram tablets, and I can see I'm charted for 1 gram, so that's going to be 2 of these tablets. And I can see that the expiry date is in 2030. Are you happy that these match?
Yes.
Great, that's my first check complete. Okay, Lee, I now need to conduct my second check. So this is when I'm going to be dispensing my medication into the cup. So the equipment that I'm going to need is obviously a cup for the patient to take the medication and a pill cup to dispense it into. So I'm going to use a non-touch technique to do this, and at the same time we're going to do our second check. Okay, so on my drug order here, Lee, I've got paracetamol written, paracetamol, and here is the drug, paracetamol 500 milligrams, and I've got 1 gram charted. These are oral tablets that expire in 2030. So to get my dose, I'm going to use a non-touch technique and tip 2 of these tablets in here. Okay, so there's 2 tablets going into that pill cup. Right, Lee, are you happy that that's 2 tablets of paracetamol?
Yes.
That's my second check complete. I now need to do my third check. Now I can either do my third check in the medication space or I can do it at the bedside. Either of those is fine, but I'm going to do it in the medication space because we have a limited amount of medications and lots of patients on the ward. So Lee, I'm going to conduct my third check now. I can see here on my medication order, I've got paracetamol written, and here is the bottle that we've been using, paracetamol 500 milligrams. So I've got 1 gram charted, 500 milligram formulation, so that's 2 tablets. And you can see in here, I've got 2 tablets. And again, this expires in 2030. Are you happy with my third check?
Yes.
Fabulous. I can now return that to stock, and these are the tablets that I'm going to take to the patient. Hello, Mrs. Berry, it's Fleur again.
Hi.
Hi, I've just come back with that medication that we talked about before, that paracetamol. Are you still happy to take that medicine? Do you have any questions about it?
No.
Fabulous. Okay, Mrs. Berry, before I go ahead and give this medication, there's a couple of things I need to do. They're called the 6 rights, and I just need to get my buddy nurse preceptor to check this medication with me at the bedside before we give it to you. So the first thing I need to do, Lee, would you perform the 6 rights?
Sure.
For me? Thank you very much. First thing I need to do is check that I've got the right patient. Mrs. Berry, could you confirm your full name and date of birth for me, please?
Helen Berry, 25th of the 5th, 1955.
Fabulous. Do you mind if I look at your name band?
Sure.
Thank you. And just checking Mrs. Berry's name band here, I can see I've got Helen Berry, the URN matches 1, 2, 3, 4, 5, and I've got the date of birth, the 25th of May 1955, and checking that with my RN. Fabulous. Mrs. Berry, do you have any allergies?
Oh, I do. Penicillin.
That's right, we did discuss this. So we're not giving you anything that has penicillin in there, and I can see that your medication chart does have penicillin listed as an allergy. Thank you very much. So that's my first right complete. My second is going to be the right drug, the right medication. So I can see, Lee, that I've got paracetamol written here, and we have actually checked, we've performed 3 checks on this medication. So these are the tablets that we dispensed earlier, paracetamol, it's the right medication. Now I know this is the right medication because I looked it up in my drug resource, and it's an appropriate medication for my patient. My patient is post-surgical, she has pain, and this medication is an analgesia. So it's an appropriate patient for my medication for my patient. I can see that I've got the right route here. So this is charted as PO per oral, and I have oral formulation tablets here. I know that this is the right route because my drug resource Tiziani told me that paracetamol comes in oral formulation, and we chose an oral formulation out of the stock. I've checked with my patient that she can swallow medications and she's not fasting. So we have the right route. We have the right dose. I've got written here 1 gram for the dose. And when we did our 3 checks of our medication, we administered 2 500 milligram tablets to make up a 1 gram dose. I know this is the right dose because my Tiziani resource tells me that 1 gram is an appropriate dose for an adult. I have a frequency here, so the right time, 6 hourly, and I can see that I've got my administration times written here by the prescriber in the corresponding column. Now I know that this is the right time because it's charted for 12 o'clock and it's currently 12, it hasn't been given, and it's been more than 6 hours since the last time this patient has had paracetamol, so I'm happy that we've got the right time. I've got the right documentation because I have here a legible order, and I checked the validity of my order before I even started with dispensing my medication. So I have a valid order, I have the right documentation. And once I've given this medication, I'm going to countersign this with my RN preceptor. Okay, Lee, are you happy that I've performed the 6 rites and that I can go ahead and give my medication?
Yes, thanks, Claire.
Fabulous. Okay, Mrs. Berry, I'm just going to sit you up so that you're comfortable and able to take the medication. Is that okay?
Sure.
Fabulous. I've got a little bit of water here for you to swallow the medication with. And I'm just going to stand by and make sure that I observe Mrs. Berry taking the medication so that I know that it's been received. I'm not going to leave it at the side of the bed. I need to see that she's taking that medication. Okay, that's great. And now that I have finished, I can sign my medication chart as part of my right documentation. So I'm going to leave the patient space now. Thank you very much, Mrs. Berry. I'll come back and check in about half an hour, like I said before, and just conduct a pain assessment and see that those tablets have worked okay for you. All right, and I'll leave her with the... Okay, Lee, now we're just coming to sign our medication chart. So the first thing I need to do is make sure there's a date present. So it's the 7th of October today. And the corresponding time, it's 12 o'clock, that's when we administered the medication. I'm a student nurse, so I'm going to put my initials here and ask my RN preceptor to countersign.